Hello, everyone, and welcome to the Wellbeing seminars of the Lent term. Today, we're happy to have Guillaume Gueguen. He's a pre-doctoral fellow at the Wellbeing Observatory at CIPRIMAP. He recently graduated from the Paris School of Economics, the Analysis and Policy in Economics Master Program. And his work focuses on topics related to well-being, perception, and confidence. Today, he will talk about the causal impact of working from home on subjective well-being. And thank you very much for coming, Guillaume. The floor is yours.
Thank you for inviting me, Katia. Thank you so much. So today I'm going to talk about telework and well-being with evidences from the UK during the COVID-19 lockdown in 2020. So just for a reminder, telework is about working from home while communicating with new technologies such as phone, email, or internet. And with the COVID-19 outbreak in 2020, there were a surge of telework in order to limit contact and contain the disease. And so in this work, we are interested in the supply side analysis. And the question is, those workers' well-being benefit from telework? And so we use the UK HLS panel data, the UK Household Longitudinal Survey, because we have data before and during COVID-19 crisis, and we use this shock as a natural experiment. I just do a little literature review in order to understand how could we expect telework to affect well-being. The literature on well-being at work is widely documented, and we know that subjective well-being is driven by well-known dimensions such as autonomy, social capital, and work-family balance, or purpose, career prospects. And telework can have an effect on subjective well-being through these different channels, but the net impact is ambiguous. For instance, when we talk about autonomy, we expect a lot of positive effects on autonomy thanks to telework. But if telework is implemented with a higher electronic monitoring from the employer, for example, this positive effect on autonomy could not appear. With work-family balance, for instance, we can say that if we let people alternate private and professional tasks through the days, they will be able to manage better and balance their time. However, the negative effect in this dimension, it could be that the frontiers between personal life and the professional life could be very permeable and could lead to a higher stress. So the net impact is very ambiguous, and the only unambiguous positive effect that we have seen is the reduction of commuting time, which is associated with a higher well-being. About evidences, before COVID, we didn't have so much evidences as telework was mainly studied in psychology or organizational sciences. And we didn't have many consistent results, even we did some meta-analysis on telework. And during COVID-19, telework was often associated with anxiety and depression, especially for women. But some of the papers didn't have the ability to disentangle the impact of telework per se from the one of the health crisis because of the structure of the data or the identification strategy and so on. So the main literature review was talking about a negative effect, but on the other hand, many surveys reveal that the vast majority of workers do not want to return to the office 5 days a week. And we see here in the Western countries a widespread of the little use of telework, even when COVID eases a little bit. So we use some panel data and use the shock as a natural experimentations. The shock is thanks to, in a sense, to the UK government's rules to work from home whenever it's possible in 2020. This rule enables us to rule out the selection effect, as we know, for instance, that individuals with high work-family conflict tends to sort themselves in telework. And these rules enable us to identify teleworkable jobs. I'm sorry. So we will use a different and different approach. I'm sorry, there's a little bit of sound. If anyone could please mute. Thank you.
Yes, I could also, if you could, yeah, please mute the mics. Thank you very much.
Thank you. So we use a different and different approach with two-way fixed effect. Thanks to the UKHLS, we have data before COVID and during COVID. And we suppose that people who has a teleworkable job are people who telework at least once in 2020. And because of the fact that we have several waves of data during 2020, we benefit from the fact that people who have telework in 2020 did not do it all the times. And so we benefit from this movement back and forth from the office to home, from home to the office, to identify an impact on people having a teleworkable job. And our main outcome of interest are self-declared life satisfaction and the well-known measure of psychological well-being, the GHQ-12 General Health Questionnaire. So we find a positive and stable impact on life satisfaction and a decrease in the feeling of being constantly under strain through times. Those two effects are quite stable, but average effects could hide some dynamics effects. And we found that some negative effects are here at the beginning, but they fade out over time. And we also see some positive effects that strengthen over time. And the positive effects and the negative effects are not homogeneous among population, such as we found that telework benefits more for couples and people living in rural area. Telework in the UK, I just talked about it like for 1 minute, because it's very key in our identification strategy in order to interpret our results as causal. We have a first lockdown legally enforced in the UK, March the 26th, with the stay-at-home order widely spread in media and social networks. And we only had 4 reasons to leave home during this moment of national emergency: to do some exercise, to shop for essential items, to fulfill for any medical, to travel and work from home when it is absolutely necessary. So it was very difficult for government to identify people who have a teleworkable job, and absolutely necessary is a very subjective notion. And we have two strict lockdown, the first between March and June, and the second one between November and December. However, the indication, the statement to work from home whenever it's possible has been stated during the overall 2020 years, as telework was a key strategy in order to contain the disease, as it is shown in the document, How we Plan to Rebuild the UK government's COVID-19 recovery strategy. Let's talk a little bit about the data. So we have 4 waves before COVID, 4 yearly waves, and we have 4 waves during COVID because the UKHLS created a special module, special COVID-19 module with a content that adapted as the sanitary crisis develops. And during COVID-19 in 2020, we have bi-monthly waves. So we have May, July, September, and November. So these 4 waves during COVID and 4 yearly waves between 2016 and 2019 before COVID. We only focus on employed people with positive working hour in each wave, because we, of course, we're interested of the impact of telework on employed people and unemployed people who have a teleworkable job, because we don't want to compare white collar people who can telework to blue collar then could not. We also remove individuals who moved from their place between 2019 and 2020, such that at the end we have 19,216 individuals in our panel. We have life satisfaction as a main outcome, who range from 1 to 7. It's a categorical variable, but we treat it as a numerical one. The GHQ-12 gathered 12 standard questions, including relative to psychological well-being. At each question, we have 4 modalities of response, and we gather the good modalities. For example, have you recently been able to concentrate on whatever you are doing? Yes, better than usual, or same than usual. We gather those good situations into one, so in a binary variable, such that a positive GHQ is associated with a good psychological well-being. And after we sum these 12 questions in order to have a general score that range from 0 to 12. For the identification strategy, we want to study causality. So we are not interested in people who used to telework before COVID. And so we identify people who went teleworking because of COVID. So before the crisis, we can know where people are working. We have this question: do you work mainly at? The answer at home is available. And during COVID-19, we have this question: during the last 4 weeks, how often did you work at home? And we consider that someone is teleworking if the answer is always or often. And with those 2 variables, we are able to identify the people who went from working from home to working from the office, from the office to working from home, because of the COVID. So we can see here, we plot the percentage of people working at home per time. So before COVID, we roughly have 3% of the population. This percentage skyrocketed in May 2020 during the lockdown and almost 60%, and decreases a little bit in order to reach 45% in November 2020. So we can see this huge increase that will enable us to study the causal impact. We use diff and diff with 2-way fixed effects, and we consider the COVID-19 as an exogenous shock that triggered the treatment of telework. And we have to separate population and identify what we call intention to treat individuals. We define those people as individuals who telework during at least one of our COVID periods, but did not use to telework before the pandemic. And treated people are ITT individuals, but who are currently teleworking for a given COVID-19 wave. Why do we do that? Because I told you that we observe people who didn't used to telework before COVID, but during COVID, they teleworked maybe 1, 2, or 3 times, but not during all the year. And we want to benefit from this movement back and forth between the office and the house to identify an impact on people having a teleworkable job. ITT individuals enable us to really identify, in a way, it's the population of people having a teleworkable job. And when some ITT are teleworking and when some ITT are not teleworking, we can have our control group who will be people having a teleworkable job, but not telework. So as I said, treated individuals are people who are ITT. So they didn't used to telework before, but they will in COVID-19. We are in COVID, of course, and we are currently teleworking. And for a given COVID-19 period, all treated people are ITT, but not all ITT are treated, as we have some people who have a teleworkable job, but do not telework at each period during COVID. Little table with general proportion of population. We can see here that before COVID, we approximately have between 7,000 and 8,000 people in our sample, but this sample reduces a lot in COVID-19, in half approximately. We have here WFH states from working from home. We approximately have 300 people working from home per year in our sample before COVID, and these numbers skyrocketed during COVID. And you can see that for our treated people, so we do not have treated people before COVID, of course, We have only treated people for COVID-19 periods. And the treated people are less numerous than people working from home, because here we remove people who used to telework before COVID. We are not interested in those people as we consider that those people have selected themselves in telework. And at each period, each COVID-19 period, we compare people who are ITT, but not telework, to people who teleworked at each time here. So our main equation, OLS equation, we control for COVID, of course, time invariant ITT individuals, the specific reaction of people having a teleworkable job. So I can use people having a teleworkable job and ITT. It's quite much equivalent in our hypothesis. So the specific reaction of people having a teleworkable job to COVID, classical social demographic characteristics controls that I will explain later, and the specific reaction to COVID according to observables, the controls. Our treated variables, that is this interaction here, individual fixed effect, wave fixed effect, and the error term. So our characteristics for which we control is the logarithm of household income, size of the household, sex, education, ISCO, if you are a parent of a young child, if you're living in a rural area, or if you are in couple. The interaction of this control with COVID enables us to control for the heterogeneous reaction to the crisis according to the observables. The ITT, so control for the heterogeneous reactions to the crisis. Sorry, there is a little mistake here. We missed the interaction with COVID. So the COVID with the controls, control for the heterogeneous reaction according to the observable, and the interaction with ITT, a control for the specific reaction according to the unobservable. And so under our hypothesis, delta associated with our treated variable identifies this causal impact of telework on our outcome relatively to people enrolled in a teleworkable job, but not teleworking. So we have to remain that delta is a mix between within individual effect and between individual effects. It's the difference in well-being individual variation between teleworkers, those who are treated, and ITT people who does not telework. And the control group is individuals who are enrolled in a teleworkable job, but not teleworking, even though they will be considered as treated at least once, because by definitions, someone who is considered as ITT will telework at least once during COVID. We can see the results now, and we begin with this graph, who only presents raw average life satisfaction in function of three groups. So we have here the red line is about people who always work on site. The green line is ITT individual who do not telework. So of course, all ITT individuals do not telework before COVID, but then when COVID happened, the group splits in two, those who are teleworking and those who are not. And we can see here that people who have a teleworkable job, but who are not teleworking, their average life satisfaction decreases a lot through the 20 years. So reminds that the scale is not the same. Before 2020, it's yearly, and between and within 2020 year, it's bi-monthly. And in fact, we're interested in the difference between the green line and the blue line, such that the green line in COVID-19 periods is our control group. We have the same graph here, but we use the GHQ score per group. I'm sorry, this one is in French. So a high score is associated with a good mental health. And here we can see that at the first lockdown here in May 2020, the mental health of teleworkers, so it's the blue line, decreases a lot compared to the other group. However, it increases, back a lot. And between July and September 2020, teleworkers are the only group that see a huge increase in their mental health. And so this dynamic here of a very bad effect on mental health, followed by a positive effect afterward, will be confirmed in our econometrics analysis, such that we call the paper Adopting Telework. The econometrics results. So this is with the equation I presented you above. So we see a little positive impact on life satisfaction, significant at the 10% level. In average, we do not found any impact on the GHQ score. However, when we will study some dynamic analysis, some heterogeneity through times, we will see other things. It seems that we do have a persistent negative effect on concentration and a positive effect on the feeling of being constantly under strain. When I say a positive effect, it's about a good mental health, so less strain. I only choose to select some outcomes, but we have much more. We could have expect an impact on the feeling of being useful, the quality of sleep, or the fact of enjoying day-to-day activity, but we do not see anything here, at least in the average effect during COVID. And notice that the specific reaction of people having a teleworkable job to COVID is very negative here for the mental health. So people who had the ability to telework had a very bad reaction to COVID. However, when they teleworked, they did not have any additional effect. So here in average. So here we can see that we really disentangle the effect of the crisis and that people did not react the same. And here, for example, between people having a teleworkable job and people who don't. So we just saw the average effect. We can see some heterogeneity through times. We could argue two opposite potential effects. We could have an increasing positive effect with an adaptation to new social, technological, and organizational constraints. But we could argue the opposite and argue an increasing negative effect because of lack of social contact in firms, a lack of informal communication, monotony, and so on, such that we are interested in studying the effect of X consecutive months of their work on subjective well-being. In order to do this, we use this equation. It's roughly the same that the first one I presented you. However, we split the treated variable into 4 treatment variables in order to study the effect of consecutive months. For instance, here the variable associated with delta 5 is about being treated the first month and being the first month. And delta 7 here is associated with the variable that say I have teleworked in May, in July, and September, and we are in September. And so this specification here enables us to partition the ITT people, intention to treat individual, people having a teleworkable job, into 4 possible treatment states with not teleworking as a reference state. So for instance, delta 7 here, we can interpret it as the effect, the causal effect of having teleworked during 3 waves, so 5 months, relatively to not have telework, but having a teleworkable job. It's quite convenient. So this is the results, the econometrics results. So here with the 1, 3, 5, and 7th months is associated with the variable we just saw here. And we can just plot those coefficients in order to be, so it's more convenient to see it in plots. So I'm just going to see the plots here. So here we plot the coefficients we just talked about. Let's begin with life satisfaction in blue. At the beginning, the first months of people who telework, so it's the first time they telework, as they did not, before COVID. We have a very little positive effect, significance at the 10% level. And here, at the third month, we have a strong positive effect, significant at the 1% level, but the statistically significancy fade out a little bit over time, but remains positive. It's also because we have less and less variable, less and less people that we observe through time. So I remind you that here the scale is not the same for life satisfactions that range from 0 to 7 than the one from the GHQ that range from 0 to 12. For the GHQ, we see a negative impact at the beginning, but it increases quite well, and we have a very high and significant impact here, the 5th month of consecutive telework, with a little bit of stagnation here on November. We can do the same with other outcomes, more specific outcome that compose the GHQ score. Sorry. The feeling of being useful. This one is quite interesting. The first month, people do not feel useful at all compared to their colleagues who stayed at the office. However, after 7 months of consecutive telework, we observe that they feel more useful than their colleague. And we have this really monotone increase of on the feeling of being useful. And I remind you that when we just saw the average effect without talking about dynamics or temporality, we didn't find any effect on the feeling of being useful, as a negative impact here and the positive impact here summed to 0. We saw a negative impact on concentration with the first specification, and in fact, the negative impact is mainly driven by the first months, where people have struggled a lot to be concentrated while working from home. However, this negative effect fade out over time here. So people seem to adapt to their constraint. The dynamic on the feeling worthless is quite the same with the one of feeling useful. We feel worthless, more worthless than our colleagues at the beginning, but however, we feel less worthless than our colleague after. Estimates on the ability to take decisions. Here again, we have a very negative effect at the beginning. This negative effect turned out to be positive after 5 months of consecutive telework here. And it's faded a little bit afterward. And the last one was the estimates on the feeling of being constantly under strain. So this is the most stable effects, positive effects we saw, even though the third month the effect seems to be null. In almost every wave, we see a positive impact on the feeling on being constantly under strain. So it seems that telework has a really good and immediate impact on stress. So to sum up, at first, individuals who telework have a loss in concentrations. They feel less useful and have difficulties to take decisions. However, those negative effects disappear over time. So we study heterogeneity through time. We can study heterogeneity across population. Here again, this equation is very similar to the first one I showed you, sorry. We just add a bunch of interaction terms in order to isolate the specific impact or the specific effect of being in couple while teleworking compared to teleworking and not being in couple. So we control for being in couple here in the characteristics, the specific reaction to couple to COVID, the specific effect of having a teleworkable job and being in couple, the specific effect of having a teleworkable job and being in couple to COVID, and finally, how a treated variable interacted with how a couple variable. We want to study heterogeneity with a couple, people living in rural area, gender, and being parents of a young child or not. So we see that couples and those living with no co-resident child catch the main positive effects on life satisfaction, while people living in rural area and couples catch the main positive effects on mental health. Here, for example, we are interested in this one here with the life satisfaction. We see that people living in couple catch the main impact on life satisfaction. They do experience a very high increase in life satisfactions relatively to single people teleworking. We can see here too that people who do not have a child as a co-resident experience a positive effect in life satisfactions, while people being parents do not. For the GHQ, it's people living in rural area who catch a very, very important part of the positive effect here. We have also other effects on more specific outcomes. People living in rural area experience a little increase, increase or decrease in the ability, in the likely to be depressed, so they feel less depressed than people living in city while teleworking. People in living areas seems also to catch the positive effect on strain, as it does not remain significant here when we control for the interaction with rural area. We also see that men catch a little bit of the increase of the positive effect, sorry, on the feeling of being constantly under strain. And the last one, we see that people living in couple experience a higher happiness than people who are single but who are teleworking. Let's discuss of the causality, because I try to tell you that our results should be interpreted as causal. However, there is a lot of objection we can make, and we have to discuss about it. So we stated that people who are ITT, intention to treat individuals, are people who are enrolled in a teleworkable job but did not use to telework before the pandemic. It implies that all people enrolled in teleworkable jobs are supposed to have telework during at least 1 month in 2020, which might not be true because we might not observe all of them. Because, for instance, people could have only telework in August, and we don't have any data for August. And maybe someone could have a teleworkable job, but the employer, did not allow him to telework during COVID. So that is another problem. And I remind you that our identifications takes advantage from the movement back and forth from the office to home, from home to the office, on people having a teleworkable job. And we assume that those movements between work location are decided by the employer, that the employee does not have the choice to choose the work location where he has to work, which is of course under discussion. We also said that the decreasing negative effects through time may be due to learning process, as teleworkers learn little by little how to adapt to their habits, to new social and technological constraints. However, it might also be due to a growing selection effect through times. As at the beginning of COVID, of course, the crisis was very intense, and a lot of people respected the rules and teleworked whenever it was possible. But it's possible that as we go through the year and as our relationship with COVID evolves, people have more and more the ability to choose whether they work at home or they work from home, from the office, sorry. Such that our learning process that we hypothesize, the increasing positive effects, might also be due to growing selection effect through times. People who love teleworking keep teleworking, and people who do not love it go back to work from the office. So in conclusion, we have positive effects of telework, mainly on couple and people living in rural area. We hypothesize some adaptation effects. However, it's very difficult to disentangle the adaptation effect from the growing selection effect. And this paper aims at insisting on the importance of the transition to telework and the learning processes that occurs when these new constraints occurs for employee. So I finished my presentation a little bit earlier than I thought, but thank you for have listened to me. And if you have any comments or questions, please go home.
Thank you very much, Guillaume, for sharing this very interesting work. And indeed, we have 20 minutes now, which is fantastic. So if anybody have questions, please feel free to unmute yourself and jump in. Sure, Michael.
Hi, thank you very much for that. I really enjoyed that. Was really interesting. Sitting working from home, I was curious to hear what that would be. I wonder if you did the most. So my understanding was that you compared people who worked from home versus against people who could work from home. But I wonder if actually really the more interesting comparison is between those who did work from home versus those who couldn't. And the reason I say that is I'm thinking, well, what's going on with these people who sometimes work, who can work from home sometimes, don't at other times? So that suggests there's like something strange happening with their work or the rest of their life. Like clearly we need some story as to why these people can do it sometimes but not others. And so you might think, well, look, if your employer is forcing you to be back in the office, then something bad is happening at work. So it might just be quite a personal story. So the thing I'd be interested in was actually the comparison you didn't do, which is those who do in fact telework versus those who don't, and then what the differences are between that.
I'm sorry. I'm just sorry. Could you just repeat the last thing you say? I didn't understand. Listen to well. Sorry.
Yeah, the comparison I would be most interested in, or would also be interested in, is those who do work at home compared to those who never work at home. Just because there might be a difference between those who sometimes work at home. You know, if you're sometimes in the office, but sometimes you're not, there might be something going on in your work or personal life, which is explaining that difference.
Yeah, sure. But the fact is that in our conception of our identification strategy, we cannot use people who could have worked at home but didn't at all, in the sense that our control group, because the key thing is to identify people who have a teleworkable job. It's quite difficult. And we chose to identify them by saying, okay, if we observe you teleworking, you have a teleworkable job. But some people surely might have a teleworkable job, but did never telework during COVID. Yeah, we cannot use them as a control, because we cannot know whether they have a teleworkable job or not. And yes, I agree with you. That's quite unfortunate.
Thank you, Guillaume. Julia, could you please unmute yourself?
Yeah, thank you. Yeah, thank you. So yeah, I found this presentation really very interesting. It's certainly a very important area of investigation at the moment, very relevant to what we're living. I agree with Michael in a way that it would be interesting to compare those two groups, because my original question was whether what your view is on a comment, on the comment that you are possibly comparing compliers and non-compliers in the two groups that you're looking at. So there is a rule and some people comply and others decide not to. And so there could be intrinsic characteristics that kind of, these people have that kind of make them different. Whereas the two groups of people who don't have a teleworkable job and people who do have a teleworkable job and choose to telework or not are both sets of compliers in a way. And they do have, in fact, similar trends in the life satisfaction, which to me would suggest that they maybe sort of somewhat more similar in other kind of unobservable areas, and the effect in a way of the policy could be more comparable between those two groups who do have a parallel trend. In fact, it seems to me before the policy comes in. The other question that I had, so I was wondering what your thoughts would be about in this respect. And the other question that I had was, I also found very interesting your analysis of the single questions of the GHQ and how those trended, because of course they relate to different aspects of psychological well-being. I was wondering whether you have done any analysis on the actual factors of the GHQ, so anxiety and depression as a set of questions, social dysfunction, and loss of confidence, because these are actually, again, like things, I think, aggregates that would be very interesting to look at in relation to some of the important issues around working from home, such as this idea of interacting socially and the more anxiety and depression related aspects. Thank you.
Yeah, thank you, Julia. For the GHQ, so there are 12 questions, and I only showed you the outcome on which we had an effect. We do have, for instance, a question on confidence. However, we do not have any effect on it. We have enjoyment, happiness, concentration, feeling useful, feeling worthless, and others. But I only chose you to show you the one on which we have an effect. About your first comment, the thing is that I think when we study telework, we can do like maybe two opposite and extreme view. We can be very like liberal and say let people select themselves or not select themselves into telework, and let people maximize their utility. How we can have a very rigorous, such as the social engineer things, where we want to do some natural for example, some random control trials and take randomly people and put them in telework or not. The fact is that this later option of social engineering might not be very relevant, because we cannot force people to telework. And I think the lesson of what we did in this work is that let people sort themselves. Of course, we were not able to fully distinguish the selection effect from the so-called learning process we call. However, what we see is that we could have a positive effects. We do not know if it's very causal or is about a selection, but the social engineering point of view might not be so relevant, because we will never force people to telework. So I try to give you my point of view and to answer you as much as I can, Julia.
Great. Andrew, could you please unmute yourself? I saw you raise your hand.
I already did it. I'm miles in front of you. Guillaume, tu m'entends là?
Je t'entends.
Okay. I think these results are probably right in some sense, in that this is actually all terribly, terribly messy. Things go up and they go down. And we did some work on this with panel data a little while ago. We found the same thing. It's really not there's not a sort of huge monolithic result that's waiting to jump out at you, but that's fine. That's why we do research. I'm confused though, and you're going to help me. There's an individual fixed effect in your regression. There's a mu-I.
Yeah.
That means any identification is comparing me now to me at some other point in time.
Yeah.
So I think all of this discussion about the control group being people who could have teleworked and don't is just immaterial. Anyone who never teleworks it contributes nothing. Well, I'll qualify that. Contributes very little to the identification of your telework coefficient. They do contribute something, because I believe they help you to identify the coefficients on the x's. Actually, if you go back to your first equation, maybe I'll be able to stop sort of talking into a void and actually hang some Greek things on what I'm talking about. Yeah, so here we are, mu-I. You're controlling for me. So treated, which is COVID times ITT times telework IT, that's me when I'm teleworking, versus untreated is me when I'm not teleworking. So this is all within. I don't understand why you say it's between. I believe it's all within. I mean, it doesn't matter. I think within's better, actually. But in your exposition, we need to be a lot clearer, I think, about what exactly it is we're estimating here. And the same thing holds for the pre-COVID waves. Of course, if you look at this directly, why the hell do you need any pre-COVID waves? Nobody was working from home pre-COVID. You know, what is the point of those waves? And the point is they actually get you a good estimated value of theta. That's what they do, actually. They get you a good estimated value of theta, the XIT. So we've got a really good idea of age or something like that. So that was the first thing that I was just not getting a good grip on. The second is what T is here.
Could you repeat, please?
T, so it's wave, or it's month, or it's year, or it's what?
Yeah, it's wave. Sorry. So there is a 8 wave, okay. 4 year before, and 4 yeah.
Okay, so a very unhelpful thing to say is, of course, the COVID waves were at particular times of the year. So COVID-2 was in May, I think you said. If you're going to do this kind of analysis, you want to have a month of interview fixed effect, is my guess. I mean, the English are always miserable in April, May, because it's meant to be nice and it's still raining. So you'd want to pick that up somehow. You need to be comparing the same months to the same months. I guess that was the other big thing I wanted to say. Oh yeah, can you help us with the deltas? Can you go to your next equation? That's the one with the delta 4, 5, 6, 7 and so on. Yeah, that's the one. Treated first wave, I got confused. So there's 4 COVID waves. You can be treated in any one of them, or all 4, or none. Say I'm treated times second wave. Does that mean I'm treated in the second wave, or I was treated in the second wave and I was treated in the first wave?
Yeah. You're
Well,
treated in the second waves and you have been treated in the first wave.
Oh, I see. I see, I see, I see. Then somebody who wasn't treated in the first wave is never treated with any of these deltas.
No, in fact, I'm talking about waves, but for example, someone who has been treated for 2 consecutive waves, it would have been treated, like, for example, in September, in May, in July, but also he did November, the September, November.
I understand. Okay, so treated second wave means this is the second consecutive wave in which I've been treated. Yeah. I see. Okay, so this is a duration of treatment. Okay, that's cool. Thanks. I couldn't get that. I guess the last thing I wanted to say is just be a little bit careful with GHQ. You're in the realms of multiple hypothesis testing here. It's always easy to find something that works. And we need to have a little bit more of a idea of what you expected to find before you show us the results in some sense. But other than that, I'm glad you're doing this. I think this is good information to get into the public domain. Thanks.
Thank you, Andrew. So I will try to answer your first question. Where was it?
C'est bon, you replied.
I replied. Okay.
Yeah. No, we talked about it as we went along. That's okay.
Yeah.
It's okay. I think we're cool.
Okay. Well, thank you.
So since we discussed identification extensively, I wanted to ask you a question about the interpretation of the results. And you had this equation with the treatment duration. I was curious, so you find that the effects for life satisfaction and for the GHQ in terms of adaptation work in different directions. For the life satisfaction, there was some effect at the beginning, if I'm not mistaken, that got attenuated. And for the GHQ, it worked other way around, and you have something significant at the end, but not at the beginning. Do you have some intuition about why they behave so differently?
No, and in fact, we do not say that they behave differently, unless maybe in their temporality, in the sense that in both of the variables, we observe an increasing positive effect that stabilize a little bit, or that's fade out a little bit over time. For example, in GHQ, we reached the highest point in the 5th month, or mainly in September, whereas in life satisfaction it happens more quickly during only the 3rd month. The global GHQ score is quite difficult to understand, in the sense that we have a lot of dimension, and we thought that the effects we had on the different dimensions could be very difficult, very different. But the thing is that we have this peak here in September, and to be true, it's a little bit weird, because in almost every every component of the GHQ, we have a peak, a rich of a positive effect in September. And we were asking it with Claudia Senik, and maybe, you know, it was the first, how we said, the end of the summer vacation when you go back to work, and it's the first time where you go back from vacation, but you telework and you don't have maybe this huge rupture between holidays and work, such that we have this huge spike here. But we do not explain it differently, the GHQ score and the life satisfaction stuff.
Yeah, so in that case, I guess Andrew's idea about adding month fixed effects might eliminate, if you think that this is just a September result. Thank you. So we have a couple minutes for one last question, if anybody is willing to jump in.
We have Andrew again, I think.
Andrew, did you raise your hand again, or it is from the last time?
No, I've got an individual fixed effect, which is I forgot to take the thing down, actually. And I don't know how to do it. How do I get, oh, there we go, lower hand, got it. I nailed it, sorry about that.
Can I jump in again?
Yeah, sure.
So yeah, I don't think I communicated it well enough, but I don't think you answered my original question. If you can go back to one of your other pictures, back one more. Yeah, so this one. Okay, so I'm thinking that there might the people who sometimes work at home. So the green line, the people who could work at home but don't. There might be different things going on in their lives from the blue line, people who could work at home and do. So in a certain sense, you might think there's just kind of some weirdness going on there. Like you haven't given a story as to why the people are sometimes working at home and sometimes not. So I guess I'm interested in just like, what's the difference if you just look at, if you sort of average the green and the blue line, you just compare always works at home to never works at home. Sorry, sometimes works at home to never works. Just what's the difference between those two? And then that kind of irons out, you know, are you sort of the oddness of why some people are sometimes working at home and sometimes not? So that's like, do you have a teleworking job which you ever use versus not? And then I'm curious at what actually the difference is. And it looks from this like almost the interesting, looks like there probably isn't much difference there. And the bigger story is that, you know, basically you want to have it like the jobs where you can sometimes work from home are better jobs.
Yeah. The blue line, we are not comparing people who always work at home to people working sometimes at home, in the sense that in the blue line and in the green line within COVID, both of the groups will telework. So both of groups telework sometimes, in the sense that if we have someone who is currently teleworking in September, in May, July, September, but not in November, he will be on the blue line during all the beginning from July to September, but at the end here in November, he will be in the control group.
No, so I'm saying the interesting comparison I'm interested in is between people who sometimes telework versus those who never telework.
Because like in the definition of the telework variable in itself, you mean? Yeah, we tried. We did not find anything, but we thought that because there were 4 levels of answer for the question, how often did you work at home during the last 4 weeks? We had so often, always, sometimes, and never. We only choose to focus on always and often because we are interested in a high intensity telework menu, and we didn't have a lot of effects on sometimes telework, and we expect that people who are teleworking sometimes, they are not teleworking like every week, for instance. We suppose that, for instance, like if you telework like at least once once a week, you telephone like maybe often. And we chose to do this specification because I don't remember the name exactly. It was Washkik and Felsted, I think, who study the UK HLS COVID-19 models as they were working on it on the generation of the questionnaire. They choose to study telework with this definition of always and often. So we don't know it with sometimes. And there is also a very few observations we have, so it's quite complicated.
Okay, unfortunately, we are out of time. Thank you very much, Guillaume, for sharing your work. And thanks everyone for joining. Hope to see many of you next week. The same time, we're going to have Arnar Boanson, who's going to talk about the causal effects of depression and anxiety on life satisfaction.